Hey guys, welcome back to Urology 101. If you're watching this one today, then perhaps your wife told you that the factory is now closed, or you want to shoot blanks for the rest of your life. And either way about it, I applaud you. Because I've been on the forums, I've looked on Reddit, and there is no thread that starts off with how excited somebody is about their vasectomy, or how great it felt, or like it felt like a massage. I mean, yeah, right, maybe in prison or something like that. So let's have a straightforward conversation about what a vasectomy is, some of the post-op concerns. We're going to put a few myths to rest, dispel a few fears, and by the end, I hope you agree that it is the safest, most effective form of permanent contraception that you can get. And let's start off with what a vasectomy is, because based on reading on some of those forums, I think some of you guys are confused out there, because plenty of guys think I'm doing something, or we as urologists are doing something to your testicles, and we're not. A vasectomy is interrupting the vas deferens on each side, and it connects the testicle to the urethra, and you have one coming off of each testicle. And all it is a tunnel. That's how the sperm get from the testicle up to the urethra. So what we do is we isolate it and we occlude it, and there are different methods to occlude it. Talk to your urologist if you're really interested in exactly what they do. There are about 3 or 4 that are really well studied to show that they work equivalently great. Now, let me show you in the model here about where exactly we're going. So the vasectomy happens right here. This is the vas deferens, testicles down here, epididymis, and a fairly anatomically large penis compared to the guy's bladder or his entire rectum and colon. But at any rate, so the vas deferens wraps around and then enters behind the prostate into the urethra. We go toward the scrotum for it because that's the easiest place to get it. Now, when a guy comes in for the procedure, there's always a counseling session and we go over all of the concerns that are into that. And then when the procedure comes around, it's a 5 to 15 minute thing. It can be tolerated and done under local anesthetic, and not everybody tolerates that well. So there are people and there are urologists who will do it at surgery centers or with some light sedation. If you think you're somebody who needs that, then talk with your urologist about it. If you think that you're going to do okay without it, that's great. It's tolerated with local. Sometimes people can put some local on the skin as well before you actually get the needle and then the anesthetic in, because yes, the needle does feel like a pinprick and it does burn going in. Local anesthetic is designed to take away specific sharp point tenderness. It doesn't do anything for pressure sensations, and guys will feel pressure on this. You will feel us moving the testicles around some to try and get that vas deferens up to the front of the scrotum where the skin's really thin. Some of us will use 2 incisions, some will use 1 incision. I tend to use 1. I bring both or each vas deferens to that incision. And if you're concerned about what incision somebody's going to use, then talk with your doctor about that. Now, after the surgery, it's really important to be using some compression underwear, something like a jock strap, tight-fitting underwear. Ice is going to be your friend. We usually tell people a bag of frozen peas or vegetables or something like that because it conforms to the scrotum in like the irregular shape. But you can use ice as well. The 20 minutes on, 20 minutes off thing, none of the post-op stuff for this is really sexy, but it works. Compression, elevate the scrotum a little bit, maybe put a towel under there to decrease some of the swelling, and then ice. Most guys are going to get some bruising, and you're going to see some bruising track down around the bottom of that scrotum. That's because of gravity. Now, there could be more swelling, and I tell people that if it swells up like a baseball, that's really okay. And if it swells up like a grapefruit, then I want to know about it, because that's a concern for something called a hematoma, which is a collection of blood. All right, it does happen. It's not common. About 1 to 2% of guys will deal with it, and it doesn't necessarily mean that you need any surgery or anything. It just might take longer to recover, and that's no fun, and it doesn't happen much, but it is theoretically possible. We are operating in an area that, as any guy knows, just tends to expand, and it'll contract some, but man, the scrotum just is elastic and it expands. So that's always why we want compression and ice to be part of your post-op care. All right, we'll give you Motrin, we'll give you narcotic pain control. Hopefully that gets you through the first handful of days. And after about a week, you can get back to doing whatever you want, whatever you're comfortable with. Now, a lot of guys are going to be concerned about post-op pain, and if you look on the internet, or if you look even on Wikipedia, you're going to find post-vasectomy pain syndrome, stuff like that. And I think a lot of guys too are pretty frustrated by how much we minimize the pain because I don't think it's sold and talked about very much. The deal here and the reason to minimize it is because we want you to get back to your life. It's not that we don't care about it. 95% of guys are going to be done with their pain after the surgery after about a week. So that leaves about 5% that are going to have some lingering discomfort. Now, the thought on that is either compression from some of the nerves that are around the vas deferens. So when we cut that, when we seal it, you can compress some of the really tiny microscopic nerves, and that can bother some guys. The other main thought on this one is that it's a congestion problem, right? We've now blocked the tube that allows sperm out of that testicle. So they're not going anywhere, the testicle swells up a little bit, and that swelling creates this like achy, throbbing sensation that just doesn't feel good, like somebody's squeezing your testicle. It's kind of like a mild blue balls thing. And that sucks. It's terrible. But it's not a sign that there's a bigger problem. And so it's not a minimization thing. We want you to get through it. It's just that it's not a pathology that you're causing more harm as you do stuff. And so the more you can get back to your regular life and just sort of put that to the side, the better off you are in the long run. Now, about 1 or 2% of guys, based on the American Urologic Association, will have long-term chronic testicular pain like that, of varying amplitudes. Now, once I have heard of a vasectomy being reversed, I haven't gotten to that point with any of mine, but I have at least know of somebody who has reversed one, and that has solved the pain in that patient. But it's not something that has to get done commonly. So I hope that takes away some of your fears about some of the long-term pain. The next thing that we talk about with this is obviously whether the vasectomy worked well, right? Because that's why you're getting it, to make sure that you don't have sperm coming out, so you can have sex and fun without any concerns about pregnancy, right? So what we do is we want you to take a week off of ejaculating. So after the surgery, nothing for a week. That allows those tubes to heal up and seal. Wait the week, then go crazy. We want about 20, 25 ejaculations. Some guys are back in a week with a sore forearm. That's fine. But most of us will say come back in 6 to 8 weeks, try and get 20 or 25, clear out the tubes, and then we'll see. You drop off the semen analysis. What we're looking for is no sperm. About 80% of guys, no sperm in their ejaculate. 20% of you will have some sperm left. Now, usually that's what are called rare and non-motile sperm. And sometimes there are just a few little guys back and forth. And we'll ask you guys to repeat a semen analysis just to be certain that you are good to go. Because when we tell you you're good to go, don't worry about contraception, go have fun, we want to be certain for you. Now, it's not perfect. So about 1 in 2,000 guys will either come across a pregnancy or have a vasectomy that fails in a way where it like recannulizes and you have sperm coming out. 1 in 2,000 may sound kind of scary, but if you think about it, that's better than 99.9% effective. And that is better than getting a girl's tubes tied. That's better than oral contraceptive pills. It's better than an IUD. It's as good as it gets. So really take it and run with it and just be like, all right, I'm good, I'm sterile, I'm ready to go. And you really, really should be. It's a rare occurrence when you're not. The important thing is that until your urologist tells you that you are sterile and good to go, that you are using whatever form of contraception you're using right now. Do the post-vasectomy semen analysis, get the okay, don't assume that you're fine, and then you're going to be in good shape. All right, a couple other things to talk about. If you really search on the internet, you're going to see that vasectomies have some research linked to them with prostate cancer. For the most part, there's no good data on that. There was a study that came out in 2015 on that. They crunched a ton of numbers that was out of the NIH. And really what they did is put to the test the phrase that there are lies, damn lies, in statistics. Because they just looked at a lot of numbers and did some fancy statistical manipulations to get to say that there was a significant association between a vasectomy and some prostate cancer. But if you really look at the raw numbers, there wasn't. And there's no good data with randomized trials where you take a bunch of guys who are 25 to 35, give them a vasectomy, and then 30 years, 40 years later, see if they have prostate cancer. There's nothing out there like that that exists. These are all studies looking backwards, looking at guys who are 60, 70, 80 with prostate cancer, and hey, did you get a vasectomy? Right, so vasectomies are common, prostate cancer is common, and of course you're going to have an association in some groups of people. there's no set mechanism on how a vasectomy would even be involved in creating prostate cancer. There are some theories, but none are really proven. So I don't think that that's something to be concerned about. The American Urologic Association doesn't even recommend that we really get into that conversation because there's no good data to support it. Now, the next thing that I kind of want to talk about is this thing called scalpeless vasectomy, because you're going to come across that too. And there are going to be a lot of urologists who offer it, and I do it, especially if my patients want it. But it's a gimmick. And maybe some people are going to come after me for this, but I think it's a gimmick. Because all that's doing is bringing the vas deferens right to the front of that scrotum, and you take a sharp clamp, and let's say you just push down and spread. That's all you do. You don't actually do it with magic. It's not like, oh yeah, my doctor did this scalpeless thing, so I didn't even have surgery. I think that's the concept that people are trying to put forward, it's perfect and you didn't even need an incision, I didn't give you surgery. And that's not true. You still have to isolate the vas deferens. You still have to occlude it. You still go into the scrotum. It's just that we've gone in there by ripping a hole in there as opposed to just making a small incision. So scalpels are fine. If it's a small incision, it's going to heal the same way. There are people who will say that a scalpeless means that you go next to the nerves, you don't cut them, that it heals better. I mean, give me a break. It's a scrotum, it's wrinkly. Nobody's really looking for a 1 centimeter incision. So I don't think a scalpeless offers you any better of a vasectomy and a result than a scalpel. The main things that you want when you try and find somebody to do this for you is, are you comfortable with them? Do you feel comfortable in their hands? Because chances are you're going to be awake with them doing it with you standing there, and you got to be comfortable with that. You have to have confidence in your surgeon, and that's what you got to look for. So, ask them how comfortable they are. If they do it in a way that you're looking for, then go with that and have a lot of comfort irrespective of scalpel versus scalpeless. I don't think that's something that should really matter a lot. All right, I think those are the main things with vasectomies, right? We talked about some of the post-op concerns with pain, talked about hematomas, the prostate cancer myth, and then scalpelless and no scalpel, and kind of what a vasectomy is. I hope that really helps. Send me your questions, send me your concerns. If I need to add a little bit more to this, then we'll do that. Otherwise, I hope this takes care of it for you. We'll see you soon. Stay healthy, all right? Bye, guys.